people everyone. In this episode I'm going to talk about one category of mood disorder that is called bipolar affective disorder, which is commonly abbreviated as BPAD. It is one of the most common mental disorder in Bhutan. Bipolar affective disorder is a psychological illness that involves severe mood swings. One day you're so happy that you feel as if you're on top of the world, and the other day you feel depressed and down. A feeling of irritability can also be one common manifestation. Episodes of mood swings may occur multiple times. They may include mania, less severe form of mania known as hypomania as well. It is classified into bipolar affective disorder 1, where mania episodes can occur alone or it can occur together with depression. In bipolar affective disorder 2, hypomania occur along with depression. A manic episode is a distinct period of an abnormally and persistently elevated, expansive or irritable mood that usually lasts for at least 1 week, and it is present most of the day or nearly every day. A hypomanic episode lasts at least 4 days, and it is similar to manic episode except that it is not sufficiently severe to cause impairment in social or occupational functioning, and no psychotic features are present. Psychotic features here refer to delusion, hallucination, disorganized speech and behavior. So during this period of illness, 3 or more of the following symptoms must be present, and it represents a significant change from usual behavior. Firstly, there is inflated self-esteem or grandiosity. They become so confident, feeling powerful and capable of a lot of things which is actually not possible and it is unrealistic. Example, telling you that they are a supernatural being, having a lot of power and having power to control everything. So in Bhutanese context, it is usually culturally related, whereby a person claims himself or herself as Guru Rinpoche, Khandrum or fourth king, which is the common manifestation. Second one, there is decreased need for sleep. Even if they sleep for only 3 hours, they become completely rested. Third one, there is increased need for talkativeness. Fourth one, a person with bipolar affective disorder experiences a popping of thought one after another in the mind, and they feel that their thoughts are racing and there is urgency for speech. So they are distracted very easily. Sixth one, there is increase in goal-directed activity, either socially or at work, school or sexually, or there is psychomotor agitation, whereby they engage in purposeless, non-goal directed activities. So a person with bipolar affective disorder, they have tendency to engage in activities that hold the potential for painful consequences. Example, foolish business investment, reckless driving, use of harmful substances, or engaging in gambling activities. The depressive side of bipolar disorder is characterized by major depressive episode resulting in depressed mood or loss of interest or pleasure in life, as we have talked in our previous podcast. So the mood disturbance or symptoms which I have mentioned above is sufficiently severe to cause marked impairment in social or occupational functioning, or to necessitate hospitalization to prevent harm to self or others, or there are psychotic features if it is a manic episode. So now, what are the risk factors or prognostic factors for bipolar affective disorder? So it is categorized into biopsychosocial model. So in biological model, it mainly involves genetic. So a person with bipolar affective disorder, so usually there is imbalance in neurotransmitter, and not only that, having first degree relatives such as parents or siblings with bipolar and other mood disorder also put you at risk of getting bipolar affective disorder. Secondly, life events and environmental stresses such as sudden death of loved one or accident or any other traumatic events which is usually dependent on an individual. This would increase the risk of developing a bipolar affective disorder. So a person who use mood altering substances like cannabis and alcohol for longer duration are also at risk for getting bipolar affective disorder. So with this, I come to the final segment of this episode where I will be talking about treatment of bipolar affective disorder. Although bipolar affective disorder is a lifelong condition, you can manage your mood swings and other symptoms by coming forward for treatment. Firstly, the patient is stabilized by pharmacological treatment, whereby a person is given medicines and it helps in balancing the neurotransmitters and gradually involving them in talk therapies, and it can also be combination of both, indeed a best option. It is important that we pay attention to early warning signs such as mood swings so that we can prevent it from getting worse and seeking professional help as soon as possible. Avoiding using drugs and alcohol and taking medication exactly as directed by professional help would help manage a person with bipolar disorder. Thank you so much.